Hi, I'm Michael Hoxson from HoxsonHealth.com. Today I'd like to talk a little bit about wrist injuries or wrist pain, specifically in capoeira, and it's a fairly common injury. And I'll use as an example a specific move, the negativa. When you get down on the floor and you put your hand planted on the floor, a lot of times people develop pain after a while. And it's not just with negativa, it's with any movement where the hand is planted on the floor and you're putting your body weight on it. So the problem is not so much in the wrist. It could be due to some wrist stiffness in the joint, but what I find is the problem is a little bit further up the kinetic chain. Really more in the shoulder girdle complex, and more specifically around the scapula or the shoulder blade. Okay? So what happens is this shoulder blade, which is resting, scapula, which is resting on the rib cage, it has a lot of movement on the rib cage. The scapula could move up, it could move down, it could move in, it could move out, it could rotate, it could tilt. So there's a lot of mobility involved in the shoulder. And that's why our arms can go all the way around and circumduction and all these different movements and all these different planes of motion. But when we forget that, the rest of our body compensates. So when there's lack of motion around the shoulder complex, that motion can be compensated at the wrist during specific movements. All right? So the movement in particular that's lacking in the shoulder girdle when someone has a chronic wrist pain is usually what they call scapular depression, where the scapula moves down on the rib cage. And there's several muscles that contribute to that perform that motion of depression. Primarily, it's the serratus anterior, which is a muscle on the front of the scapula, which connects or attaches to the rib cage. Then you have the pectoralis major, which is in the front, the pecs, where they attach to the front by the scapula. It also pulls down the scapula or depresses it. Then you have the lats, the latissimus dorsi, which come over here in the back more superficially. It pulls down. Then you have some others, couple smaller minor muscles, such as the lower fibers of the trapezius muscles, our traps, okay? And then the pec minor, pectoralis minor, which is just a small part of the pecs, which also goes in the front over here, into the rib cage and the scapula. So all these muscles together, they depress. Movements such as when we do push-ups, when we do dips, these movements contribute to scapular depression. But because scapular depression involves more deeper muscles, let's say, meaning the serratus anterior, and the more superficial muscles such as the pectoralis major tends to be overused, overdeveloped, so it tends to shut off the neurological connection to the deeper, more stabilizing muscles that are closer to the joint or closer to the bones. So anyway, not to get you too confused with anatomy, because you don't have to be an anatomist or a therapist or a doctor to understand these concepts. Just understand that someone with wrist injuries or wrist pain, chronic, in a martial art such as capoeira, could probably be due to lack of proprioception or just awareness of the movement of the scapula on the rib cage, which connects the arm to your spine to the rest of your body. All right? It's a whole kinetic chain. So just by simply creating an awareness over here in the scapula area, can take a huge load off of the wrist. All right? So the next segment, I'm going to demonstrate specifically in the negativa how you could start rehabilitating that motion of scapular depression. And it's very simple. And along with some wrist stretching into extension, okay, those two things can help you get past the wrist pain so that you can enjoy capoeira. Okay. In the negativa, let's say with the left hand, the hand is planted. Normally, you put most of the weight in your hand. That takes pressure off of the wrist a little bit and off of the knee, the opposite knee. It takes pressure off of the wrist if you know how to use your shoulder blade. So the movement here is where I'm pushing my hand, the heel of my hand, down into the floor so that I feel the pressure, I feel the muscles working around the shoulder blade. Okay, I can feel my lats, my pecs a little bit here, and there's not a lot of motion, but you're contracting these muscles because it's moving the shoulder blade on the rib cage subtly. Okay, so you're pushing in through there rather than you're just pushing through your wrist like this, and you're not getting much support from where the arm is attached to the trunk. So when you're in this position, it's not just pushing the heel of the hand down into the floor, feeling it more in the shoulder blade, okay, or in the scapula. It's also contracting the abdominal wall. Pull in your abdomen or contract it as you're pushing in down into the ground. That takes pressure off of your lower back, takes pressure off of your opposite knee, and takes pressure off of your wrist because everything's working together. This is why a lot of people, they get lazy, they don't think, and they just do what feels reflexive and automatically, and they can't get down in negativa because their knee hurts, patellofemoral problems, they have wrist pain, they can't put weight on that hand, and sometimes they even have lumbosacral pain or lumbosacral injuries or issues. So a form of an exercise for rehabilitating this to improve on this is not just stretching out the wrist. That's one part of it if you have wrist stiffness. But a lot of times people that have wrist pain, they have too much movement in their wrist joint. So you get into negativa. Now instead of putting your other arm up like this to protect, you can put your other hand down, heel of your hand down into the floor. So both hands down, push into the heels of your hands, and just lift up your body, feeling it in the shoulder blade, not so much in your triceps or the back of your arms, but lifting up, feeling it in your shoulder blades, pulling in your abdomen, and hold that for an isometric contraction. Now you're not holding your breath, you're holding the muscle tension in an isometric contraction. Hold it for about 20-30 seconds to start, work your way up to about a minute, and then relax. And then you could do that for repetitions, okay, with some rest in between each contraction. So this is just a simple way that you can start retraining your nervous system. And you don't need any fancy schmancy equipment. You just need your body and your attention and your awareness to how your body functions. Okay, so that's it for today. I want to thank you again for being here again for another segment. And until the next time, Michael Hodgson at HodsonHealth.com.